Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the subject of physiology with the topic neurophysiology or nerve muscle conduction and with the subtopic action potential. So let's start.
Welcome. We will be discussing neurophysiology, specifically action potentials. To start, could you explain the ionic basis of the depolarization phase?
The depolarization phase happens when, upon reaching a threshold voltage of minus 55 millivolts, voltage gated sodium channels open rapidly and sodium rushes into the cell down its electrochemical gradient, causing the potential to become positive, roughly 30 millivolts.
That's correct. Now, what specific process causes the change from the peak positive potential back towards the negative resting state?
So that would be repolarization, the falling phase, when sodium channels inactivate or close and slower voltage gated potassium channels open, allowing potassium to rush out, restoring the negative internal charge.
Excellent. To follow up, what leads to hyperpolarization, where the membrane potential becomes more negative than the resting potential?
Uh, Hyperpolarization is also called the undershoot phase when potassium channels remain open slightly too long, causing the potential to dip below resting potential before returning to normal.
Yes, that's precisely why. Now, how does the neuron return to its resting potential after the hyperpolarization phase?
Uh, After the hyperpolarization phase, uh, the
You've
resting
correctly identified the ionic movements that cause the fluctuations. However, the return to the resting potential isn't solely because of those channels closing. Another mechanism is involved. What do you think helps maintain the resting potential stably?
The resting membrane potential is maintained by high permeability to potassium or leak channels and low permeability to sodium managed by sodium potassium pump.
Exactly. How does the sodium potassium pump contribute to this specifically?
The sodium potassium pump maintains this gradient by uh, by pumping in uh, 2 sodium and pumping out 2 potassium, 3 potassiums
You've
constantly.
remembered that it pumps against the gradient, but the direction and number of ions seems to be confused. Can you tell me again how many sodium ions are moved and in which direction, and how many potassium ions are moved?
Yes. So the sodium potassium pump transports 3 sodium ions out of the cell and 2 potassium ions into the cell.
Excellent, that's correct. Now, how does the presence of a myelin sheath affect the propagation of an action potential compared to an unmyelinated neuron?
Uh, the presence of a myelin sheath increases the propagation of an action potential as compared to an unmyelinated neuron.
Yes, that's right. What term is used to describe this faster jumping propagation along myelinated nerves?
Uh, can you repeat your question?
Certainly. I was asking what specific term is used to describe this faster jumping propagation of stimulus along myelinated nerves.
I don't know. Can you explain?
It's called saltatory conduction. This occurs because the action potential jumps from one node of Ranvier to the next. Can you tell me why the action potential doesn't generate in the areas covered by myelin?
I don't know.
The myelinated areas don't have many voltage gated sodium channels, which are essential for the depolarization phase of the action potential. Those channels are concentrated at the nodes of Ranvier. Shall we move on to synaptic transmission? What are the main differences between an electrical and a chemical synapse?
No, thank you.
Okay, I understand. Would you like to discuss a different topic like the RAS function or perhaps nerve regeneration or wrap up for today?
Can we wrap up, please?
Certainly. We can conclude the examination here. Thank you for participating. You may discuss any further questions about neurophysiology with your instructor.